Hello, everybody, and welcome once again to another episode of On Call Medicine. My name is Phil, and with me, as always, my good friend, Dr. Todd.
Hello, everybody. Welcome back. Thanks for being here. This is actually kind of an exciting episode for us because this is the first episode that we're shooting since we launched the podcast on YouTube and Spotify and all the apps. So, because, I'm sure most people probably aren't shocked to hear this, that we filmed several episodes before posting them live.
Right.
Or live is not the right word, but for posting them so that we could edit, make sure we had enough things to put out there that people would want to hopefully consume. So this is the first episode we're shooting after maybe a little feedback that we've received. So I think that's pretty exciting.
Absolutely.
What kind of things are you hearing?
I've actually been hearing a lot of great things. People have really been enjoying it, what they've been able to see. I think it seems like the very first one is one of the most popular.
Yeah.
That and the ADHD episode.
Oh, without question, yeah. And I think that's my hope is that as people maybe stumble across, this content, our channel, as they start perusing it, they'll see topics that catch their eye and check it out. And if you have enjoyed any of this, please consider subscribing.
Absolutely.
Help us grow this. Give us a like, share, comment, all the things.
Give us a follow.
That's right. And then we'll keep doing this and having fun with it because I know it's been a blast for me.
Absolutely. It's been a great time. I've enjoyed every minute of it.
Me too. And today's episode is going to be another one that I see. It's one of the most common diagnoses, frankly, in an outpatient setting, and that is headaches. But, Phil, I would say before we get started, I thought I'd be comfortable in this sweater. It's a little hot. I think I'm gonna take this off here and get. Can we get? Let's just see here. Sorry about that.
You gotta be kidding me.
Sorry about that, guys. Completely unscripted reaction. In case you can't see it, listen to Phil. It's the only prescription you'll ever need. If you like it, maybe we'll let us know. We'll get you.
Those are not for sale. No,
not yet. But anyway, Phil. Hey,
wow.
What do you think?
Wow.
Your wife's gonna love this.
Yeah. That'll definitely be a fun one.
So speaking of headaches,
did
this give you one?
Yeah, just a little bit of a tension headache. There we go.
For sure. Great segue into it because tension headaches actually being one of the most common forms of headaches.
Mm-hmm.
I don't know. Tell me, have you yourself ever really dealt with headaches?
I've had periodic headaches. They come and they go. There's no rhyme or reason or particular thing to set them off. I have experienced what I thought of as kind of like a sinus headache. I've had that a few times, right in this kind of region, and it starts around certain times when I start to, the seasons change and maybe I'm having some drainage issues and they start to pressure up and get my eyes watering. And
I think a lot of people would I think agree with that, or at least say that they share that sentiment. It's interesting though. This is actually one of those sort of fun facts in medicine. Most sinus head or what is thought of as a sinus headache is actually not. It's actually a form of a migraine or a tension headache. The thought is about 80% of quote diagnosed sinus headaches are actually probably not truly sinus headaches. Now, with that said, it's hard sometimes to distinguish right at that moment, but generally speaking, the thought is a sinus headache is usually like a true sinus headache should be accompanied by fever, congestion, drainage, and then of course the headache that comes with the sinus pressure. But it's actually kind of interesting because most we'll say self-proclaimed sinus headaches actually are a form of migraine, and this can come on with triggers of, say, change of season, pressure changes, tension. Because we know that those are all things that increase the risk of headaches.
Wow. Never really thought of it that way. Let me ask you this. So you're saying sinus headaches, tension headaches. I mean, how many different types of headaches are there?
Yeah, great question, because this is headache 101, I guess, for med students, or if anyone's out there watching this who's maybe going into medicine, or you're just interested in headaches, or you experience headaches. When I got out of training, headaches were something that kind of scared me from a clinician perspective, because I was worried that I'd have a hard time maybe recognizing the subtle differences between what is a common everyday symptom compared to something that is, say, catastrophic, right? Because the subtleties that sometimes sit in between those can be hard to distinguish sometimes. And so when I got out of training, I was like, man, this is not something that I love. Now, it's interesting. I was super fortunate to be share an office with a migraine specialist, headache specialist. I won't mention her by name. I won't do that again, in case you watched the diabetic episode.
Thanks again, Keith.
Exactly. Kyle, actually.
Kyle.
Yeah.
I meant Kyle.
Yeah. No, Keith. But anyway, so this doctor, we'll say, doctor.
I was thrown off by the shirt. I'm still looking at that.
That's okay. It's a beautiful.
Wow.
It's a beautiful sight. But we'll say Dr. C. So Dr. C was and is the headache guru, frankly, in this region. And she was a wonderful mentor in that world. So she taught me almost everything I know, actually, about management of headaches, treatment of headaches in the outpatient setting. But going back to your question, so long-winded answer here to get back to how many headaches are there. Well, we first like to differentiate headaches between what's called primary headache and secondary headache.
Okay.
And what that means is a primary headache is where the headache itself is the problem. So that's the primary diagnosis. So migraines are a form of that. Tension headaches are a form of that. Cluster headaches, or sometimes called suicide headaches, because the pain is so intense. I think like 30% of people with cluster headaches have actually considered suicide that's how severe those headache symptoms are, and how debilitating the headache symptoms can be.
Oh my! I didn't know about those.
Yeah, and those, and perhaps something we'll get into a little more here shortly. But most people with cluster headaches, they tend to know it. They tend to be sort of one-sided. There's a lot of tearing, so their eye may water a lot. It'll be kind of shoot behind the eye. Thankfully, they're relatively brief, 15, 20, 30 minutes perhaps. Interesting, oxygen therapy is a great method for treating tension headache. Cluster headaches. Now, if you don't have access to oxygen because you're at home, right?
Right.
If you have access to a fan, go open the freezer, put the fan on the other side, and try to blow some of that cold air at your face. That actually, there's been, we'll say it's not exactly been studied, but there is certainly some evidence that those strategies can help alleviate that. So remember that if you have cluster headaches.
Interesting.
But those are the primary headache syndromes. And thankfully, by and large, primary headache syndromes aren't really the dangerous headaches. They can be extremely debilitating at times. And if you look at the lost income and lost productivity and days missed from work, primary headaches are certainly top of the list. Secondary headaches are the headaches that tend to keep us up at night, from a physician perspective, from a worry perspective. These are where the primary problem is something entirely different. That's not the headache. The headache is a symptom of the problem.
Okay.
And this is where you'll see things like, say, brain tumors or aneurysms, or a brain bleed or something, or an infection of the brain. So these are the headaches that are caused by a different problem, and then sometimes you may hear there's something called thunderclap headache, which is associated with what's called a subarachnoid hemorrhage. So this would be a bleed or ruptured blood vessel in the brain, resulting in what is oftentimes termed thunderclap headache. The worst headache of someone's life, and this is a medical emergency. I mean, these are frankly, you have to have medical attention. Minutes
right away.
Ago, right? Because you don't have time to wait with these types of things. But yeah, I think that's a pretty good initial overview. Of the kind of the different headache syndromes and different headache types that we'll see.
That's a lot, man. I didn't know there was that much into headaches. From what I've experienced personally, now I will say my daughter, unfortunately, she gets migraines all the time, and they can be pretty debilitating. To to the point where sometimes it induces vomiting.
Sure.
It
Yeah.
gets to be so intense.
Yeah.
And like with what we've experienced, see, I only thought there would have been a two of, between sinus tension and a migraine. And it's kind of interesting how the cluster, sometimes some of the things that you describe sound like migraine. Some of them sound like the tension headache.
Yeah, absolutely. And that's why it can be a little hard to distinguish sometimes between the different forms. And then when you see headache syndromes in children, oftentimes, because this is not unheard of, it's not maybe the most common thing that you see, but it's actually quite interesting. A lot of youth or say pediatric population, they can suffer from abdominal migraines. And so,
Abdominal.
yeah, where they get abdominal pain as maybe the main manifestation of a migraine.
Wow.
And this is where, I don't know if your daughter experienced that or not, and you don't have to share that with the world, but it's not uncommon for youth who experience headaches on a regular basis to also have a lot of abdominal symptoms, whether it's related to the headache or not. And that's because the abdominal, so there's what's called the enteric nervous system. And so the stomach has its own nervous system called the enteric nervous system. There's about 100 million nerve cells that reside in this system. And it's connected to the central nervous system by communication through the vagus nerve. So the wandering nerve, this cranial, vagus nerve. Actually, interestingly, not named after Las Vegas. Actually, when I was in training, I thought it was, because it was like, well, the wandering nerve, you wander to Vegas. It's not. But it's how I remembered it.
Did you ever say that out loud in class one day?
Oh, probably. Yeah, probably.
Okay.
Yeah, I was not afraid to look dumb. And by the way, if anyone out there listening who is maybe enjoying this because they are in medical school or training, just know that it's easy to feel, ill-equipped or unprepared, and when you're surrounded by what you view as very competent, intelligent people. But just know that they're all full of it, and they're all just trying to figure it out at the same time. And so please do never, ever be afraid to speak that mind, and kind of the expression, there's no stupid questions. Well, that's not entirely true.
Sometimes there are.
Sometimes a little. But by all means, do not be afraid to say what is on your mind, because I can almost guarantee you somebody else is thinking that same thing. But anyway, just to close that thought up, the enteric nervous system. It's actually, so this is why, when some people, when they get nervous, they'll have bowel symptoms, right? Like we sometimes refer to it as a nervous bowel, because that nervous system is so closely connected to your bowel through that enteric nervous system. And so migraine symptoms can manifest through the GI tract, which is, again, just another, like, really, in my opinion, it's kind of cool. I mean, obviously I don't like that people experience it, but it's another kind of, we'll say, neat facet of headache syndromes and migraine syndromes, and just human physiology, frankly.
Wow, I love the fact that as we continue to do these shows, there's so much more to learn. I've always seen things at kind of a surface level. Now, granted, I didn't go to medical school. I didn't learn all the things that you did. But it really is fascinating to just kind of see different dynamics and different things I never considered prior to us starting this.
Yeah.
Let me ask you about the secondary type headaches. Now, honestly, just now, when you were describing some of those things, and before you even got to the word tumor, my mind instantly went to Kindergarten Cop. I was thinking of Arnold Schwarzenegger. I got a headache. Is it a tumor? It's not a tumor,
Yeah.
But, obviously in those kind of situations, that might be a case. That might be something related to the tumor. I got a little scared when you started talking about the thunderclap.
Yeah.
That almost sounds like the onset of a stroke,
Sure.
the way you described it.
Yeah, and it can be. And thankfully, I suppose most of the time with that type of headache, it's not real subtle, because it's the subtleties that tend to, that can be a little bit more just unsure. But yeah, these are serious symptoms, and they tend to come with other, say, physical manifestations too. You can get what's called a complicated migraine, which is going to have symptoms and signs of perhaps a stroke. And these are things that you obviously you do not wait on. Like you call EMS, you call 911, you go over to the hospital because you'd rather find out later that it was a migraine than find out that it was in fact a stroke or a brain bleed.
Right.
Because these are things that require immediate attention. And things like brain tumors. Certainly they're it's never a good thing. It's and that's not to say all brain tumors are malignant in nature. I mean, there are benign tumors that can cause symptoms. But, if there are other symptoms associated with those headaches too, what we call maybe focal neurologic signs, these are things that we look for when we're examining somebody. If you've ever had the doctor tell you to, puff out your cheeks real big and, wrinkle your forehead, close your eyes and, can you feel me touch you? Follow my finger. All of those are all exam techniques that are looking for focal neurologic deficits. Because when we see those things, that is immediately top of the list in terms of priority, in terms of concern.
Okay. Well, then, how about this? Based on just what we've talked about between primary, secondary, and some of the dangers that could be associated with either set, what are some important things to really look out for? What are some red flags that kind of catch your attention, say, this needs to be dealt with urgently?
Yeah. So the biggest one would probably be, there's an expression we use called first or worst. And so anybody who maybe really never dealt with headaches, who's all of a sudden experiencing headaches, even if it doesn't come with any of those other maybe red flag symptoms, probably should get taken care of or should get looked at. If somebody comes to me in their, say, 50s or something and they've really never experienced headaches, but now they are on a somewhat consistent basis, we're going to take a look there because that's not normal. Now, worst headache of your life, so, first headaches or worst headache, that one's probably a little more obvious. So if somebody has a headache that is a bone-crushing headache, they're probably not going to ignore it. My plea to you today is please don't ignore that,
Right.
Because these are the symptoms. When we start, who needs imaging, right? So that's one of the questions I get asked a lot. Is do we need to pursue brain imaging? And the answer is yes on those circumstances, certainly. The other situation that might warrant brain imaging would be if, let's say, the character of your headaches is changing. So if you come to see me and you say, hey, I've had headaches most of my adult life. Maybe I get them 2 or 3 times a month, worse when the seasons are changing and the pressures are changing. But by and large, it's fairly predictable. But if you come in and say, hey, doc, lately these headaches have been different. Like it's a different portion of the head. It's a different symptom onset. It's not responding to the medications that I typically take or the over-the-counter stuff that I might take. If you're noticing a change in character, then you need to get that looked at. And so that would be another reason that I would pursue imaging. And typically that imaging is going to be with an MRI. CT scans, not super useful when it comes to headache evaluation. I mean, it's going to show a brain tumor.
Sure.
So if that's your only goal is to see if they have a brain tumor, well then sure, it would show, generally speaking, it would show most of that. But X-rays and things like that not going to be super useful. But yeah, that would be I think first or worst or changing symptomatology. Those would be things that would warrant further discussion with your doctor.
Really good to know. Absolutely. Well, how about this? What are some ways that people can go about not only dealing with pain management in the heat of that situation to where they're in the middle of something? What are some good remedies that they can put to use, but also maybe even some preventative things that they might implement?
Great question, Phil. Go to oncallmedicine.com, visit the blog. We have a post on headaches. Excuse me.
We also have great shirts, apparently.
That's right. We will at least. So check it out. So there's a lot of natural remedies that I talk about on the blog. I'm going to share a few of those here. Obviously, I'm partially joking. We want you to be able to come here for information also. But so magnesium actually is like human's best friend.
Okay.
And so if you want to look at natural ways to improve headaches, you look at how they treat pregnant women who get headaches, because in pregnancy, medications are very limited. You can't use, frankly, almost anything in pregnancy due to the potential harm to baby. But what you can use is magnesium. You can use riboflavin, which is vitamin B. I believe it's B2, riboflavin. Those are two natural, we'll say, headache supplement killers. Like they absolutely do a fantastic job of targeting headaches. So I recommend those every day in my practice. Magnesium glycinate, which is one of the ones that are probably better served for this. Now, I suppose, again, I know you guys probably get tired of hearing me say this too, but disclaimer, not necessarily should be taking as say precise medical advice.
Right.
Consult with your doctor. But these are some of the things that I tell people often. Vitamin D actually is really, really good for headaches also.
Okay.
Staying hydrated is crucial. And the other thing too that sometimes gets overlooked is vision change. So if you wear contacts or glasses, having an up-to-date eye exam is actually crucial because subtle changes in your prescription actually can produce headaches. And so we see this a lot with diabetics. This is partly why we want diabetics to get regular eye exams. But one other thing too, I wanted to maybe touch base on, kind of before I forgot, because if you've stuck around long enough, you probably know that I'm pretty, I guess, a little bit nerdy when it comes to the science. I like diving deep into the science.
Sure.
And so what is the mechanism for migraines, or what are some of the mechanisms that produce headache symptoms in us? And that is, there's two that are worth knowing.
Okay.
There's one called calcitonin gene receptor peptides, so CGRP. It's a mouthful.
That is a lot.
Yeah, and the other one is called substance P. And the way that these work, when a headache starts, there's a release of these substances, or this calcitonin gene receptor related peptides, and actually they cause they cause disruption in blood flow.
Okay.
So oftentimes they cause a dilation in blood vessels, which actually will increase some blood flow. And then substance P actually modulates the way that pain is received by the brain. Another fun fact, there's actually no pain receptors in the brain. So headaches are not a result of, say, firing of pain receptors in the brain. They're actually the structures surrounding the brain that produce the headache symptom. And so these chemicals are actually targeting those structures outside of the brain. And so one thing you may ask, or at least this is what I asked when I was learning all this in med school, was, okay, well, why does the body produce these things anyway? It sounds like they're bad news, right? It can't, right? So, and there's a reason for that. So it's not intended to be bad. You know, when there's a injury, for example, you get a release of these things because you want to get more blood flow to the area. So because you need to recruit cells that can come in and say if it's an infection or if it's a whatever, it can target that. The problem with migraines or headaches is it's an inappropriate response. And so you get too much blood flow at that moment, and you want to try to reduce some of that.
Okay.
And so some of the medications that are on the market actually are designed for that. They're designed to reduce that, or they're designed to reduce the way the body modulates or receives pain. So that's a little, I don't know, interesting tidbit.
It is interesting.
That certainly, these are the things that I enjoy.
Well, then how about this? I've got one last little zinger that I want to throw at you. And I feel like it can kind of deal with our topic. Brain freezes.
Yeah. Oh, man.
Having a nice scoop of ice cream, and all of a sudden you're wincing in pain. Somebody feels like you got shot.
Yeah.
Your eyes start watering.
Yeah. Great. This is a great one. So I had the worst.
So it's not my actual brain freezing.
No, thankfully not. It's the brain sort of thinking it is.
Right.
But we were at Disney World. Oh gosh, was it last summer? Sweltering heat. And anyway, I was drinking a slushie, and it was in that moment, it was the best thing I'd ever had, with how hot it was. But yeah, I paid no attention to how quickly I was consuming this beverage, and within a few minutes, it was the worst brain freeze I'd ever had. I was like, I'm gonna have to go lay down. Like I'm getting sick. I feel like I'm about to start like getting nauseous and throwing up. And then of course I was doing the trick that I'm about to share with you guys of how to try to abort a brain freeze but it wasn't working, at least not quick enough. So what is a brain freeze? All right.
Okay.
So the roof of our mouth actually is modified thermoreceptors. So they will, they interpret temperature. And so when you're consuming something really cold, like a slushie, there's a dilation of blood flow to try to warm that up. And when that you get a surge of blood flow that creates this intense and rapid headache. And so the way, this is what I attempted and failed at, but what you can try to do is if you experience a brain freeze, you take your tongue and you just start basically sweeping the roof of your mouth to try to warm it up. Because if you can warm it up, then you can cut down on that physiologic response. So it, again, ties back to that blood flow. It ties back to that dilation and tries the body trying to, warm itself back up. So no,
Interesting.
Thankfully the brain's not freezing, but it certainly feels like it is at that moment.
Yeah, when you get that sharp stabbing pain, it's like, I just forgot everything I learned in 4th grade about math.
Yeah, and it's silly that, at this point in my life that I still haven't learned.
Oh no, you keep going. When it's a good slushie on a hot day, absolutely.
Yeah, I guess I was just hoping that my body would have recognized the surroundings.
Right.
Just be like, all right, you get a pass.
Let's slow it down.
Yeah, I think in closing, just listen to your body, right? I mean, like anything in medicine, listen to your body. If something's changing, if something feels weird or new or different, reach out, talk to your doctor. Doesn't hurt to ask. And the other thing too, I suppose another helpful tidbit that we often use in the migraine world is a headache journal. So this can be extremely helpful to track headaches. So write down, what day, what was the day, what time was it, how much you had slept the night before, how much you'd been sleeping recently, maybe what the recent stressors were with your job or your life. What you had eaten that day.
I was going to say diet.
Exactly.
How much you drank.
Without question. Whether it be, say, alcohol or water, right? So hydration versus had you been out the night before. Is this just a hangover type of a headache?
I know my wife absolutely loves it whenever she has a headache and I'm saying, oh, did you drink enough water today?
Exactly.
She's thrilled every time I bounce back with that question.
Probably throws the water at you.
Yeah, usually.
But yeah, these are great questions because write it down because you can start to delineate some patterns, and oftentimes just making subtle changes, frankly, to your lifestyle is enough to improve things.
That's a good idea. I'm going to pass that along.
Absolutely. Don't tell her I said it.
Well, once again, it's been a fantastic opportunity to have an afternoon and do a show with you. As you mentioned, folks, if you're liking what you see, by all means, follow, subscribe, like the videos. We look forward to bringing you more content that you'd like to see. And by all means, feel free to leave a comment and let us know what your thoughts are on today's episode. But other than that, I'm Phil.
I'm Dr. Todd.
Live well.
Live well.